I always joke the only people that really talk about the replacements are unhappy ones. So frequently I'll get patients that come in, especially older patients that say, "Oh my goodness, my neighbor had a replacement and all he does is tell me about how horrible it is. I'm never going to get a replacement done." And many of those patients I treat for long enough, they develop a trust with me and eventually we go get to surgery. And the most common thing I get after surgery is, "I wish I would have done this 5 years ago. I wish I would have done this 10 years ago." I think they're both true. You want to enter surgery with healthy skepticism, healthy caution. Surgery is a big deal, and there are certainly things that I worry about for every one of my patients that could happen, and I always talk to them about it, all the risks, all the things I'm worried about. But that being said, if you put it off too long, then you get to where you start getting muscle weakness. Maybe you have other medical comorbidities that come up that really influence your health post-operatively. They may keep you from getting to the same level of recovery that we could have if we would have done it at the right time. So there's definitely a way where you can do something too soon. If you haven't tried anything non-operative, there's no reason to jump into a surgery because certainly those things can be very effective. That being said, once those things don't work and your quality of life is diminishing, don't let your life completely get, past you. You can't start missing out on family activities, start letting it affect your relationships, start getting depressed. Those things, in my mind and in most of my patients' minds, are not acceptable ways to live your life. You want to be able to do those things. And I think that's when it's the right match for surgical intervention versus just living with it, which is what too many people do for too long.